The time is just gone, 8:42 a.m. We continue with the broadcast this morning. Now, we are looking at a story that broke, and this is with regard to a Johannesburg surgeon facing three murder charges after his young patients died following surgery. And there is a report that he could face more charges. Now, Professor Peter Beale, who faced five charges, including fraud and murder, appeared in the Gauteng High Court yesterday. And according to the prosecutor, the more charges could be added, and this is obviously has created somewhat of a mixed reaction to the plight of Professor Peter Beale. And we're joined this morning by Dr. Angelique Coetzee, Chair of the Health Committee of South African United Business Confederation, SAUBC. Dr. Angelique Coetzee, good morning to you and welcome to the show.
Good morning and a very good morning to all your listeners.
Well, clearly, Dr. Coetzee, this is quite a serious development with regard to Professor Peter Beale. And, often we hear cases of medical negligence, but here we are talking about an accusation of the murder and even more charges that may be added.
Yes, it is astonishing what is happening in this field, and we fully support the statement of SAMA and strongly condemns the murder charge against Prof. Peter Beale. You cannot criminalize the medical field as it is currently being seen, especially from the authorization of the NPA, who is actively driving this. It's totally unacceptable. If you look at the accusations against Prof. Peter Beale, it's only one-sided. It's based on two or three observations, according to what we have seen in the media. Also, in the media, it was said that Prof. Beale was removed from the HPCSA, which is also not true. He voluntarily removed his name from the Health Professionals Council of South Africa. And this trial is now being dragging on, and it's going to have a lot of consequences going forward. You need to understand that most of the doctors do practice, well, not most, it should be all doctors, first do not harm. And we all understand the pain if you lose someone. Doctors also are traumatized by loss of patients, especially if they knew the patient. So if we start to criminalize medical field, we will see the going forward, there will be on his back.
Yes, and also, Dr. Angelique Coetzee, clearly there is, as I mentioned, there is a line to be drawn between murder and negligence. And just looking at the death of the three patients, what do we know about that? I mean, what were some of the circumstances that actually led to the death of these three young patients?
It's quite difficult because we don't have all the clinical notes. But I need to say this is all children working in the field of medicine for over 35 years. You will get the parents also putting a lot of pressure, especially if it's a sick child, and they will tell the doctor, do whatever you can, please just try to save. And you need to understand that there will be risks. And I'm quite sure it was being discussed with the patient, well, not the patient, the parent in this case, because they're very young. And only going on those pathology reports, it doesn't give you the whole picture. It doesn't tell you what happened. And to say the doctor murdered them, that doesn't make any sense. You cannot criminalize the medical field like that. There's avenues that needs to be followed, and that was clearly not, um, to the liking of the families. And as far as I know, some of these cases has been brought before the HPCSA. And again, I'm speaking under corruption, but he was not found guilty on those cases. I'm not saying all
Yes.
of them, but I know there was
Also,
cases.
Dr. Coetzee, this actually begs a question as to whether we have the capacity to deal with situations where there is medical malpractice or allegations of medical malpractice against the health practitioners in general, and whether we have the capacity to deal with it, or should we be doing more? Should we not even consider possibly somewhat of a medical court or a health court to actually deal with this, so that we have specialized courts that deal with this? Because again, the whole question surrounding murder is quite a serious charge.
Yes. So to answer your question, the HPCS has got a bottleneck. They do have people looking into these cases. Sometimes it takes up to 5 years for the case to be resolved. So there's a problem in that regard from the HPCSA side. They all need to get their house in order. Then it should be clear that before you go to criminalize a doctor, we're not talking about the common law court. We're not talking about the criminalization of doctors. There must be a pathway to be followed. It must be either mediation solution to of the medical area errors. We need to make sure that the HPCSA, their panel of experts, look at the case, make a recommendation, and if that all fails and it's not, the family then still feel aggrieved, then we need to look at go to a common law court. But to criminalize doctors, it's unacceptable. And also very important to understand that all reasonable and necessary steps to ensure that any medical decision making, especially exercising good faith, does not become a violation of state or criminal law. And we need to oppose any legislation which gives the government the responsibility to define appropriate medical practice and regulate such practice through the use of criminal penalties. We should be very clear on that. And therefore, a medical sort of court looking specifically at medical related cases with people, judges, experts, understanding the field. I think it's extremely important.
Well, we're definitely going to be watching the developments as they unfold, Dr. Angelique Coetzee. But for now, we thank you for taking time out and talking to us this morning here on Salam Media. We wish you all the best, and please take care.
Thank you so much and have a great day.
Dr. Angelique Coetzee, Chair of the Health Committee of South African United Business Confederation, with us this morning. We come back, we'll be joined by Mohammed Batman Ismail, eThekwini Secure Crime Talk. We're talking about the vote of no confidence and instability towards service delivery, and all of this driven by politicians.